Looks like we still have a few people joining us, so let's just give it another minute. All right, it looks like most people have joined now. Sarah, I think we're ready whenever you are.
Just to let everyone know, we are recording this to post on our communications website.
Thank you, Kathy.
Mm-hmm.
Good morning, everyone. Sarah Odell here with the Nursing Facility Program Manager here. Thank you so much for joining us today. This isn't our usual day. We ended up needing to change it because many of us were involved in a CMS virtual conference last week. A whole week's worth of virtual conference was interesting and very different. Hoping we're going to get back to some normalcy soon. Thank you all again for joining today. Licensing staff that we have on today includes Dave Alm, our licensing manager, Kathy Orias, and Sean Scott, our policy analyst. Agenda today, we have a very special guest that is going to present the vaccine maintenance program. Chris O Grady will be most of our meeting today. I want to give you an update on executive orders. As of this morning, we have 21 out of 130 of our nursing homes with executive orders in place currently. 21 of those are positive staff only. Oh, excuse me, 15 of those, I've got my numbers all messed up here, sorry. 15 are staff only with positive cases. 4 facilities have both residents and staff, and 2 have just residents that have positive cases. Our numbers had trickled up a little bit in the mid-20s, hoping they'll continue to drop. In the conference last week with CMS, they let us know that there are 50,000 backlog complaints as well as 10,000 research surveys. So just to give you all an update on our survey priorities, they haven't changed a whole lot. We continue to have as highest priorities any immediate jeopardy complaints, which means we need to be in your facilities within 2 business days of those coming into us, as well as the CMS 3 to 5 focused infection control surveys are also a high priority, but I am happy to announce those have dramatically decreased over the last several months and weeks. In fact, Oregon didn't have any for several weeks. We did have one just recently, but those surveys nationally last week went from 100 to 72, and there's about 15,000 nursing homes nationally. So those numbers really have dramatically dropped. And those are really based on an increase in week to week of cases in the buildings that triggered those for surveys. Our biggest workload and backlog right now is our 10-day complaint response surveys that we are primarily working on those right now. Following the conference last week with CMS, we will be working very closely with our CMS Seattle location on what a plan looks like to get those back into compliance. They're asking us for some data that they'll be tracking along with us to get those back on track, as well as our recertification surveys. You are seeing a few of those happening right now, and those are, we had the opportunity and we're glad to be able to hire 4 surveyors nearly a year ago who hadn't had any experience being able to do research surveys since those were put on hold because of COVID and our total response to that during the last year. So we've got folks out doing some of those surveys. And those will continue for a bit, but our highest priority before we get back to doing research on any regular basis is to get our backlog of complaints caught up. We're hearing a lot of comments from some of you about our folks being in the building. Some of our complaints are as much as 2 years old, which does make it very challenging for our staff to do those investigations. Residents likely are not there anymore. Staff that took care of those residents may not be there as well, or if they are, they may not remember, and we do understand that, and we will do our best to be able to take a look at those cases, knowing it was a long time ago, and on some of the allegations, we'll want to take a look at what's happening in your facility right now to assure that that isn't continuing to go on. And those that happened some time ago, we're going to try to get through those as quickly as we can, do what we can to get those tied up and get moving on to regular surveys and complaints as they come in, and doing those timely. I just want to briefly mention 3 CMS QSO memos that were recently released. May 11th was QSO 2119. This was reporting to National Healthcare Safety Network vaccine status of your residents and staff. You will begin reporting that to NHSN on a weekly basis starting June 13th, 2021, and you will be reporting that weekly, and those reports will go into CMS. And these, again, state surveyors won't be looking at this. This will be much like when you were reporting your other data to NHSN. If you're not doing it timely, CMS will be sending citations and non-compliance regarding those. April 27th, 2021, QSO Memo 2039 supersedes and replaces previously issued guidance and recommendations regarding visitation. So be sure to take a look at that. We know we're getting lots of questions on that, and we welcome those. And just keeping in mind to be reasonable and think about the safety of everybody in your buildings. We're not going to be able to give you answers for every single scenario you might have in your building, but if you get stuck on some of those, we're happy to help you troubleshoot those. And one last memo I want to mention also came out April 27th, QSO 2038. This is the testing requirements that have changed based on vaccination status of residents and staff. With that, I hope Chris O'Grady is on, and I'd like to turn this over to her for the next bit.
Good morning. I just requested control of the slides. I don't know, and it says it's waiting for approval. But good morning, everyone. My name is Chris O'Grady. I'm a Systems Integration and Policy Advisor in the COVID-19 Response and Recovery Unit at the Oregon Health Authority, and I am the lead liaison for our long-term care facilities that are connecting with our long-term care pharmacies for vaccine maintenance planning. And can we go to the next slide? Okay, so for ongoing COVID-19 vaccination maintenance plans, there are a few different things that we wanted to just highlight of what is informing how we are planning with our long-term care pharmacies and vaccine providers across the state. Our long-term care facilities and our congregate care facilities were among one of the first for residents and staff to have COVID-19 vaccine eligibility. And we had our clinic models with a federal pharmacy program in the winter, but that program has since concluded. Our policy goal moving forward is to maintain or get to a 75% vaccination rate for residents and staff across all long-term care facilities. So to try and get there and to track there, we started beginning on April 5th to track in all nursing facilities, assisted living facilities, and residential care facilities licensed by the Oregon Department of Human Services, that vaccination rate status in aggregate of COVID-19 data to the OHA, reporting through some survey tools. And we are asking facilities to report that on a weekly basis. And that started April 5th. We have seen a lot of facilities increase their reporting in the last couple of weeks. So we want to thank you for doing that voluntarily. In the last couple of weeks, because it really helps us to see where we're at in having vaccine opportunities and availability to our nursing facilities. In addition, our licensed nursing facilities, assisted living facilities, residential care facilities, and memory care communities and adult foster homes are directed to develop vaccine maintenance plans through options we've identified. And we're going to talk through what those options are in this presentation. And the primary resource will be contracting with long-term care pharmacies. And so you may have already been contacted by the long-term care pharmacy that you are already connected with and have a contract with, and you may have a subcontract in place to receive COVID-19 vaccines. And this really is the primary way for our nursing facilities to have access to COVID-19 vaccine. But we know that it's going to take time to ensure facilities are matched to partners, and we anticipate that some facilities may need help identifying partners and obtaining allocations. We have teams across ODHS and OHA in our vaccine planning unit pharmacy branch that are equipped to help match facilities with other pharmacies if you don't have a contracted pharmacy that is close to you or another vaccine providers during this bridge period if needed. So, what is your role as a nursing facility in developing a vaccine maintenance plan? The first part is to really develop a procedure to screen new residents and staff for COVID-19 vaccine status to see if it's needed. For residents, the facility should develop a vaccine plan within 72 hours of admission if needed. If possible, the facility should work to vaccinate a resident prior to admission. So if they're coming in from a hospital or something like that, if the hospital has access to vaccine, try and work on creating and starting that vaccine series before a resident is admitted. And for staff, the facility should direct staff to the community resources for vaccination or offer on-site support through the models with long-term care pharmacies. So this procedure is something that you just have to develop internally. We don't have a template that is required, and it doesn't need to be submitted to anyone. This is just something for you to have in place internally in a plan that you have to vaccinate residents and staff. The second part in your role is to coordinate with your long-term care pharmacy or other entity to ensure that residents and staff have ongoing access to COVID-19 vaccination. And if subcontracted by an LTC pharmacy, clearly define the operational process for vaccination administration. And we'll go into a little bit more details around what an operational process could look like when we talk through some of the most common models that facilities have in place with their long-term care pharmacy. And you want to ensure that this vaccine administration process outlines the protocol on how a vaccinator will respond to any severe allergic reactions. And this protocol should address the administration and storage of epinephrine, because if there is administration of the COVID-19 vaccine on site at your facility, there needs to be an emergency kit with epinephrine for managing in case there is an allergic reaction. And then the third part in your role is to maintain records of vaccination status and share with ODHS, LPHA, or OHA as necessary to monitor and address public health concerns. And this really is those OHA tracking tools. And we are working to integrate these tools with the new requirements that will be required to report vaccination status into NHSN. When the OHA tools were created to track vaccination status, they did know that the CMS rule was coming. So these data fields mirror what is required in that CMS as well. But for the time being, when those new data points are required in CMS, there's going to be some dual reporting into the OHA tracking tools for right now before there's data integration. So now I'm going to go over some of the models that facilities can use when they're contracting with their long-term care pharmacy providers, and these are these service delivery options. So as I mentioned, many of the facilities on this call, nursing facilities, you may have had in-person clinics at your facility through the federal pharmacy program, which was funded by the CDC, but that program ended in April. So now that that federal program has ended, it's really up to you as a facility to work with your long-term care pharmacy provider to put one of these service delivery options in place. We meet with the long-term care pharmacy partners on a weekly basis to see what their models are. So these models are an overview of what's available for pharmacies like ProPac, Payless, Pharmerica, Kinsanis, Genoa, Avamere Signature Home Health, Omnicare, and some of the other smaller pharmacies like BHS and Heartland. So the first option when you're working with a long-term care pharmacy partner is that the long-term care pharmacy partner distributes vaccine and subcontracts with a facility to administer that vaccine. That means that the pharmacy itself is the one receiving the COVID-19 vaccine allocation, either from the state of Oregon or from the federal pile from the CDC, and they'll get the vaccine and bring it into Oregon. And then they have a subcontract with you as a facility to deliver the vaccine to you and have your facility staff or other staff that you work with to actually administer the vaccine to your residents or staff. The second option is that a long-term care pharmacy gives a facility priority appointments at an event hosted by a community-based organization which they're supplying vaccines to. So this might be that a pharmacy partner has partnered with a local public health authority, with the LPHA, or another community-based organization or EMS in your area, and they actually have priority appointments for your facility at this community-based organization site. Some of these at the beginning were kind of mass vaccination sites. The mass vaccination sites will begin to close in the next couple of weeks, and we'll have much more of these smaller community-based organization events moving forward, and as we look into boosters in the fall and winter. For option 1C, a long-term care facility coordinates with a long-term care pharmacy vaccination options for residents and requests staff to arrange their own vaccination at a local retail pharmacy. So we've heard from our partner Omnicare that this is their preferred model. They also do the dispensing model, but the Omnicare might offer some certain priority appointments at a CVS location that is close to your facility, and it's up to the facility to do transportation to residents and or staff to get to those priority appointments at a retail pharmacy. And then the last option when working with a long-term care pharmacy is that they continue to offer vaccine clinics at a facility. So this means the pharmacy would be doing the ordering, they would be doing the administration of the vaccine, and they would do any of the data reporting. But because that federal pharmacy program has ended and it's not funded by the federal government anymore, many of the long-term care pharmacies are not offering this full service clinic anymore. But sometimes they will. You just have to work really closely with your long-term care pharmacy to see if this is an option or something that you can work out together. Some additional options for long-term care facilities is for option 2, you can develop a pod with other long-term care facilities in your region and become a state-enrolled vaccine provider as a group to offer vaccines to residents and staff. This would require that your facility or your pod create an account in the Alert IIS system so that you could receive a certain allocated number of vaccine doses to your facility and any auxiliary and ancillary supplies that are required. Option 3 is the long-term care facility partners with a local hospital or home health agency to administer vaccines to residents and staff. And then option 4 is if your facility is unable to implement an ongoing vaccination plan for residents and staff using any of the options above, you should contact your policy analyst and we will work together as a state team in the federal pharmacy branch to connect you with a vaccine provider and opportunity to make sure you can maintain those vaccination rates with residents and staff. And I'm going to put in this resource guide into the chat that gives more details on all of these different options and spells them out in a few more details. And before I move on to the next slide, I do see a comment that I will read from Erin. Our current issue with establishing a plan is that we only do an admission every other month or so. We are all long-term care. We can't open a vial without wasting all but one dose, and some residents aren't going to be able to manage going out to an appointment. So this is really good to know and to note. There has been guidance that came out from OHA and the CDC. Sorry, I think somebody's not on mute, and I'm getting some feedback. If you are not on mute, would it be possible for you to mute? Thank you so much. So there has been new guidance that came out from OHA and CDC regarding wastage. The preference right now is to really get anyone who is willing to be vaccinated to get vaccination. So that means even if it's opening one vial of the vaccine to get one person vaccinated, our pharmacy partners have been instructed to do that. So if that's a matter of communicating with your long-term care pharmacy, they should have that guidance. And if you have problems, I can drop my email in the chat when I'm finished with the presentation. So please just email me and we can work together. The preference really is to get any willing person to be vaccinated to offer them a vaccine opportunity at this time, given the shift that we've seen in supply and demand of the vaccine. Okay. For discharge policy and support from hospitals to facilities, our discharge policy requests hospitals administer first doses, especially if a person is offered a 2-dose vaccine series, and develop a plan for a second dose administration prior to discharge in partnership with a discharge facility. And the reason why we're asking hospitals to work with facilities on the vaccine series that's being offered is that sometimes a hospital has a certain vaccine that's available to them, like Moderna, and a facility might only have Pfizer. Sorry, I don't know why the slides are changing. So we just want hospitals and facilities to coordinate together to make sure that they can offer the series of 2 Moderna or 2 Pfizer if available and coordinate with each other when that is the case, or if another vaccine provider needs to come in because they might have access to a Moderna vaccine, but the hospital doesn't, but the facility does, just making sure that that those 2 doses in the 2-dose series can be offered to a resident upon discharge for Moderna. And then with long-term care pharmacies obtaining allocations, your facility could work with your pharmacy partner to obtain the second dose. Sometimes a lot of the pharmacy partners have different COVID-19 vaccines available to them. We've seen primarily right now that they have more Moderna and J&J available to them because they don't have as much cold storage available for Pfizer. But now that the storage capabilities and recommendations for Pfizer have changed to refrigeration, that may be changing a little bit. But definitely a conversation to have, especially if you are seeing a vaccine preference in your facility and something to communicate with your pharmacy partner about. And I'm just adding the resource guide that I put in the chat. There are more resources available at the end of the document when it comes to funding and any new guidance that comes out. Most notably, there's some funding for vaccine storage. If you'd like to become a vaccine provider, it's up to $1,000 that you can have. And then there are some training protocols and materials for epinephrine, and then standing orders for immunizations around who can be a vaccinator for the COVID-19 in the state of Oregon. And that's all I had in case, unless there are questions from anyone on the call.
Thank you so much, Chris. I think you've shared your email address with them. They can find you if they need to, if you need to jump off and not continue on with our call in case any questions come in. If they do, we can certainly get those to you as well. So I think I'm turning this over to Kathy.
Good morning, thank you. The slides changed because I had a cat get involved, so I apologize for that. Little pet interference there. So I just wanted to remind everybody about administrator changes. And with that goes the EPOC maintenance for Aspen. When we haven't been in the facilities for recertifications recently, we don't want to come in and find out that 5 weeks ago a new administrator started and we missed the notification. Generally speaking, everybody's pretty good about notifying us, but if we miss it, there's a lot of like legwork to figure out, you know, where the process failed. So I just wanted to remind all of us that our office licenses the nursing facilities, but the health licensing office with OHA licenses the nursing home administrators. So whenever there's a change, and I know I bring this up quite frequently, but whenever there's a change, two places need to be notified of an administrator change. And I put the health licensing email on this slide. And, you know, most people do know that, but it sometimes slips through the cracks. So I just wanted to kind of remind everybody about that. It's important that we keep all of our records updated for a variety of reasons, which brings me to the EPOC registration. That also requires some maintenance every 90 days, that kind of thing. So, or a change when administrators change. And I put the link on there for any assistance you might need and sort of the reasons, you know, the good benefits of keeping your EPOC up to date. And that's the reminder in a nutshell today. Again, this will all be posted on our nursing facility licensing communications webpage, where you can also check your most recent license maintains letters and those kind of pieces of information, CMP funding, all of our ongoing communications are on our web page, which is at the very end of this slide. There's a link to that, but it's also with the provider alerts and that kind of thing. So I just wanted to make those reminders for everybody. And with that, I believe Dave has something he's going to say. True? Oops.
True. Thank you, Kathy, and good morning, everybody. I just wanted to do a really quick update on the license renewals for everyone. As Sarah mentioned in the beginning, the priority for CMS right now is to work through the 10-day complaints. There have been a few recertification surveys that have been completed due to training needs for new surveyors. However, for the most part, the survey activities have been complaints. So what that means for license renewals is the license maintain letters will still be in place for everyone. And then as soon as the recertification surveys happen, then the licensing folks will actually start issuing the renewal licenses for everybody. So I just mainly wanted to make sure you know that they are still active with the license maintains letter, and then just ask that you guys continue to be patient. And as soon as the recertification surveys are done, the new licenses will start being issued.
And let me just interject that also the materials and licensing fee will be coming out regularly, annually, just like a regular license. And then the license maintains letter is issued until we're able to issue a license within 60 days of verifying your compliance following the recertification survey. So as Sarah said, there's quite a large number, what I think she said 10,000 recertification backlogs across the United States. So we do appreciate your patience on that, but I don't want anyone to panic that they're in license maintain status, you know, for over 18 months perhaps, but we're working on it. And this would be a good time to just sort of solicit any ideas or information that you would like us to talk about on upcoming news hours. I don't know when we'll be going back to quarterly. As you recall, we used to do these quarterly, and then when COVID came along, we increased our communications. We want it to be worth your time. So, you know, please let us know if there's topics that you would like us to delve into, or perhaps have a guest speaker like Chris. Thank you today. That was good. So anyway, I'll let Sarah take it from here. Thank you.
Thank you, Kathy. Thank you, Dave. So this is the end of our news hour today. Again, thank you for joining us on a Monday. It kind of threw us all off as well. Our next one scheduled is June 17th. Knowing summer's coming, we'll try to maintain these monthly, but don't be surprised if we cancel them as well. But again, we'd love to hear topics from you all so we can be prepared and present information that is of value to you all. So with that, thank you all very much for joining us today, and we will look forward to seeing you in June. Thank you.
Thank you.
Thank you.